Tyler, welcome back.
Let's do it.
Happy to be here. This is another episode of the Many Minds podcast, where we use many minds for better outcomes. I am Alex Davis, physician assistant, and along with me always is Tyler Murray, nurse practitioner, and the two of us work together at Summit Brain, Spine, and Orthopedics in Lehi, Utah. The point of the podcast, if you're new to the show, is trying to collaborate as a community and find ways to provide better patient outcomes for the patients that we each get to see. We want to explore all the different areas where you can find advanced practitioners, nurse practitioners, and physician assistants, CRNAs we've talked to as well, and everybody that lives in that space. Help us understand what it is you do each day, what makes your specialty special, and ultimately, how can we help each other?
And it wouldn't be this podcast without the general disclaimer. So this podcast represents the opinions of myself, Alex, and any guests that we have on the show. The content from this podcast is not meant to act as a substitute for professional medical advice, diagnosis, or treatment. Man, we're just here to chat it up and have a good time. And with that, we'll jump into the episode here. So today we have Brock with us. And Brock, you're in the personal injury space.
Yes.
But before we dive into that, I do want to give the audience and our listeners a little hanger here,
what
cliffhanger.
I just heard was outrageous.
Yes, if you want to hear a very, very funny story about a patient interaction with a uterine prolapse, please stay tuned because you are not going to want to miss this.
We'll get into more of that in a
We
minute.
got to, and he's probably got a few more stories, which have nothing really to do with personal injury, might I say. But
I'll give you a personal injury one later.
All right. He's got him. He's going to be delivering today.
Yeah.
I love that. Well, I'm going to let you two, because you guys have the connection here, talk about how we found Brock and how we're kind of here talking about personal injury.
That's right. Yeah. So Brock and I knew each other. We got to work together for a short period of time. We crossed over a little bit, not directly the same specialty or same office space, but we got to work together fairly closely for a little while in the personal injury world. But just getting to know you, Brock, I know what the hidden talent is. I don't know if it's hidden anymore, but tell the world what would be a hidden talent of yours that maybe not everybody knows about you.
Yeah, I mean, I'm a dancer. I think you might have known that. Did you know that? Yeah, but yeah, I'm a dancer. I grew up dancing my whole life. I don't really share it with people, but my wife makes sure to share it with every single person we meet. So
of course,
it's a big deal.
That's a cool hobby.
Yeah, I started dancing when I was about 2 and performed my whole life until I basically started PA school. I used to teach dance and go perform all over the world. And the farthest I've gone is Hong Kong, all the way to New York, everywhere.
What type of dance?
Ballroom.
Ballroom dance.
Yeah, so I did ballroom dance.
Yeah, he's a big deal in that world.
Yeah.
So that's kind of
What
cool.
was the ceiling? What's your claim to fame?
Yeah, I mean, the best I ever did is I performed on Dancing with the Stars.
Oh, that's
Just one
awesome.
time, so
That's
yeah.
cool.
All my friends who continue dancing, they're all the professionals on Dancing with the Stars now, but I decided I want to go
You got a
medical.
taste of it, though.
Oh, yeah, and I didn't like it, so
That's fair.
I decided, hey, you know what? Let's go be a PA.
Yeah.
That sounds much better lifestyle than...
Seems like a natural transition.
Oh, yeah.
Of course, yeah,
It's
makes
natural.
sense. Makes sense. So how did you get to where you're at now then? Kind of give us the professional resume here of what you're doing now and how you got there.
Yeah, so I mean, I started my undergrad at UVU. That's where I met my wife. What was that, 10 years ago?
UVU.
Yeah, in anatomy with Dr. Shively. So
Yes,
shout out to
sir.
Dr. Shively. And
If you've done the course, you'll know what we're talking about.
Exactly. If
Yeah.
you've done that course, you know. But so we met there. She's doing dental hygiene. I was going to medical. What made me want to do medical is, as a kid, my older brother got sick, kept going to doctors. They kept saying, it's just the flu, whatever. And then finally he saw a PA. PA drew blood work and he had sepsis.
Oh my goodness.
And so I went to primary children's and survived miraculously. So from that point, it was always like, hey, you know what? PAs are pretty cool. You know?
Yeah.
So we always respected that PA. And I had a friend's dad growing up who was a PA as well and kind of put me under his wing and kind of showed me that way. I didn't decide PA until after I got home from my mission. And I decided, you know what? I'm going to do this. I wanted to be a biomechanical engineer before. I wanted to do prosthetics.
Cool.
Design prosthetics, but so natural transition into more orthopedic stuff. But
and you're from here locally, but you went to school on the East Coast.
So from Pleasant Grove, went to UVU, got my undergrad there, and then went to Mass General Hospital IHP for school right on the coast of the harbor. And we were out there for a year for didactics, and luckily there's 8 PA schools out in Boston, and so they said, hey, if you guys can get rotations wherever you want to go, set them up. So I set up all my rotations here in Utah. So
really?
I called the U's director, which was awesome, little plug for them, and they helped me set up all my rotations.
Oh, very cool.
Even though I wasn't a student there. So
that's awesome.
he gave me emails to preceptors and talked to them and got it all set up. So I did my whole second year through the University of Utah and IHC. But
that's awesome.
Yeah, after that, luckily being out here for that year, I was applying for jobs all throughout the last couple months. Always had a want to do hands-on stuff. Like I feel like every PA, everyone you guys have talked to as well, it's all, I always want to do hands-on stuff. And so I felt like orthopedics kind of meshed with me, and applied to every orthopedic job on Indeed, and went and met with my first employer, Dr. Sonnenberg, and sat down, and it was just him. He was running his own solo practice, and he offered me the job. And I don't know why, but I don't know why he chose me over other people. I did show up with crumble cookies to the interview.
Good move.
The staff told me that was a big sway in my favor. So if you're looking for a job out there, show up with a treat. Because bribe is always acceptable.
Underappreciated.
Oh, yeah.
It's not just the surgeon or just the one person making these decisions.
Yeah.
There's a lot of people that have input and have a say on who's going to join the fold.
Yeah, our nurse actually is the one who said she pushed for me. So
yeah, I
gave them the box of cookies, and I think she got me the job. So
that's the
what a good trick.
That's the move right there.
I mean, it's a hint for school. It's a hint for life. Always be nice to the nurse, to the MA who's helping you out.
Take care of the people.
100%.
It'll make life so much easier. But yeah, so from there we started just a general orthopedic practice, just elective procedures. We operate a couple times a week. We weren't really busy. I was seeing like maybe 10 to 12 patients a day. For orthopedics, that's crazy slow.
Right.
But it gave me a great opportunity to talk with Dr. Sonnenberg. He taught me a lot over 2 years I was with him there. Showed me stuff, would show me journal articles of any questions I had and show me research on it, would help me do all this in surgery, would train me on what's going on. We had the time, so he was able to sit me down and walk through 12 patients a day. And then we started to get busier. And then I think Dr. Sonnenberg just started opening up into this personal injury world where we'll talk about a little bit more, is a whole different beast of its own. He started getting calls from attorneys just saying, hey, could you see a couple of our patients who've been in car crashes? And we'd bring them in and start treating them. And people really liked the way we did it. And so we just started getting more and more referrals. All the attorneys started sending to us. And then I think within a couple months, it was 90% of our practice was personal injury. And then I started seeing 30 patients a day.
Yeah.
We got flooded with personal injury. So from there, Dr. Sonnenberg's a little older and decided he wanted to retire. We got bought out by a complete personal injury practice, and that's where I've been working for the past 3 years. So coming up on 6 years out of PA school.
Do you feel like it's ran the same way?
No, very different. This one's run really different. It's more of Dr. Sonnenberg's office was more of like a ma-pa shop of, hey, it's just there's 6 employees, 7 employees, so
most of it's
awesome.
family. And
most of it's family. He took great care of us. If you needed time off, whatever, he was fine. This one's more of a bigger organization, and so I got lucky for 2 years to have that kind of cush job. And I still have a very cush job compared to a lot of other PAs. So.
Sure.
Yeah. So key us in then, kind of fill us in. Maybe somebody who's not as familiar with what personal injury entails as far as from the healthcare provider standpoint. Yeah,
so basically a personal injury patient is anybody that is basically suing someone. If you see all those billboards, Siegfried Jensen, Craig Swap, now you're going to see them all over the place. I'm sure you see them all over the place. Every billboard is some sort of attorney. And usually they have patients dog bites, falling in manholes, car crashes.
Slip and fall.
Yeah, slip and fall at the Walmart. Or, I've even had where the elevator dropped and the patient fell and hurt themselves. Anything where something went wrong causing injury to someone, personal injury basically. And so what we do is the attorney will get them set up with us, and we just evaluate them, and total body evaluation of how were you doing before the accident? Now we've had this accident. What's different? What's causing you pain? And it could be everything. I have people who come in and circle their entire body of this is what hurts.
Where does it hurt? Here.
Right, exactly. The whole thing. Yeah. And if you think I get patients who are in 80-mile-an-hour car crashes, everything's just sore.
Yeah.
And so our job is really figure out what was injured in the accident, what's really hurt, what's just muscle pain, soreness, and what was actually hurt. So we do that by examination. We do that by MRIs, imaging, and basically off of patient stories of this is what I was doing before, this is what I was able to do, and I can't do that now. And
are you seeing patients early on in their post incident, or are you seeing them throughout, or kind of what does that look like?
Our First Care Medical is the office I work for. We see them throughout the whole thing. Lately, it's been getting more and more. We're seeing them within the first week or two after the accident. So usually, hopefully, if they're in a bad accident, they'll go to the ER and get evaluated and whatnot. They'll get a referral, but you guys know they don't know where to go with that referral.
Yeah.
And then even if, say, you walk into an orthopedic office and you say, "Hey, I was in a car crash," they're not going to see you. You have to pay cash. Health insurance won't cover that. Mm-hmm. And so that's the cool thing I like about our gig is it's really underserved populations where people don't have health insurance. They don't have any of this, and they can't go. They don't want to go to the ER because it costs too much money. They don't want to go to an office because they have to pay cash. And so we actually work through the car insurance and through the attorneys. And so a lot of these people, I'd say 90% of my patients don't have health insurance and have not seen a medical provider in years. And so it's really cool. You're in this suburb area, but you get to see all these people who are underserved. And
we take care of a few of the personal injury. It's a subset of what we do. Yeah. But what I found is that if you do get them early on, it's a lot easier to establish a treatment plan that's maybe going to be more successful just because we have the experience of knowing how a multimodal approach really is the most effective.
Right.
And too often times we get caught up into the silo care where they just go and exhaust one avenue of treatment. So I've appreciated being able to see patients earlier on in their in their setting so that we can, build out appropriate plans. So I love that.
Exactly. Yeah, a lot of our patients come from chiropractors. You'd be amazed how many people get into a car crash and you're like, "Did you go to the ER? Like it was 80 mile an hour accident?" Like, no, straight to my chiropractor. Yeah. Like, you had some blood. Like, you got
did
some
they do any
stuff.
pictures? No,
they didn't do anything. So, I mean, so the good news is we actually just bought out probably, I want to say 12, 15 chiropractic offices. And so we have chiropractors, we have physical therapists, we have pain management docs, we have surgeons, we have everybody there. And so the good news is we actually get to the patients within the first week or two. Yeah. And so chiropractors are their own, they help some of our patients, if it's what's going to work, we send them there. If it's physical therapy, we send them there. But it's that multimodal approach like what you're talking about. We get in early, we make sure, hey, we catch something. Like I've seen patients a year after a car crash, they've had care, physical therapy, chiropractic therapy, and I do one MRI, full thickness rotator cuff tear. Yep. Like, okay, so we could have fixed this a year ago. And so the good news is I feel like we're developing a system where we can get to these patients faster and help them get out of pain and get back to work. Because that's what they want. They want to get back to regular life.
Such a needed service too. All those resources you're describing, and all of that is dedicated to personal injury. Yeah, which is so unique and so needed. Because I've seen that exact same story play out. Initially, you're in a car accident and everything hurts. Yeah, and so you might get to one specific specialty or provider, and they're really going to help you with that one specific need. Mm-hmm. But you also had a rotator cuff tear. Yeah. You also had a herniated disc, or you also had a torn meniscus, or you had a dozen other things. So it's such a valuable service for this population that probably wouldn't have access to it.
Right. Yeah, that's one of the things I love about my job is I get to serve underserved in suburb of Utah. I didn't have to go to rural Ephraim or Vernal to go see some of these underserved patients. I get to do it right here, and there's so many of them. I mean, I average 15 to 20 patients a day, and they're all personal injury, all car crash. And so
I know if we open that door, we would see
there's a big need for it.
There's a huge need. I didn't believe it coming into it.
Yeah. And it's a whole different area of medicine. We don't have to deal with health insurance. I don't have to I order MRI, you get the MRI. I don't have to get prior authorizations, fill any of that out. That's the nice part is I kind of feel like I get freedom to treat the patient how they deserve to be treated hey, you know what?
This is what you need.
You need an MRI of your shoulder. We don't have to jump through all these hoops. Go get the MRI of the shoulder, and we'll figure out what's going on. We'll get through a lot faster. Yeah,
kind of speak more to that for us then. Of how is that getting funded then? How is that? Yeah. How is that available to you?
Yeah, so we kind of work on a special system. We're getting into the business side of it, but we work on something called a lien. So that's why a lot of these practices don't like to see car crash patients because you don't get paid until the settlement's done, or you don't get paid until the lawsuit's over,
which can be
years. We have patients 5-6 years down the line that we're still seeing, we're still treating, and they haven't received any payment on it. And so a lot of practices understandably don't want to front that money. And then what happens if they lose the case? You lose that money, and so
pretty vulnerable.
There's that little higher risk with that of going into liens. That's why these practices don't do it. And so, what happens is we get the referral from the attorney, and we send the bill to the attorney, and the attorney holds on to the bill. Once they settle out the case, they'll go negotiate with car insurance. Car insurance will fund and pay back pay everything for it. Basically, it's like car insurance is paying for it.
Sure.
At the beginning of your crash, you get something called PIP, which is like usually $3,000 to $5,000. They'll pay for some treatment. If you pass that, then you got to hold it basically as a loan until the settlement finishes out. Sometimes it's 2 months, sometimes it's 5 years. You never know.
Does that affect what you do day to day? Is it different? Because I think everybody in the healthcare community is familiar with the restrictions and the way that we need to work synergistically with the health insurance providers.
Right.
How does that system work with personal injury?
Yeah, so it does affect what we do, unfortunately, just like health insurance affects kind of how we approach things sometimes. Basically, we still try to follow health insurance guidelines. We still want to do PT for a certain amount of time. We're not just going Rambo on it and just doing whatever we want to do. We still try to follow proper medical protocol of this is what the injury is, this is what the steps of treatment are. Really the biggest thing I feel like that hinders us is sometimes the limits are really low. So in Utah, they have a low limit policy. Say you got $25,000 and the patient doesn't have health insurance and they don't have money to pay for anything else. And so you really got to look at it and say, okay, we got to be good here. We got to be good within this amount of money. So that can be a little bit challenging sometimes but the good news is our bosses are awesome and they'll help lower payments or costs of some stuff to help if the patient needs it. So
are you getting this information ahead of time when you see a patient? Do you understand the numbers as far as what you're working with?
Sometimes, yeah. Sometimes it just depends on the case. Usually I start off very conservative until we have more information because the last thing I want to do is bill a patient and then it ends up going straight to them for a cash pay visit, which we don't want that to happen. So it's just like the same with health insurance. You want to make sure it's covered before you're ever going to do anything because it's expensive. Those surgeries and those things are very expensive. So I try to understand as much as possible. And so whether it's coming from the patient of, hey, has your attorney given you any information of what's going on with this? And so it's just, I feel like it's just like you guys asking, do you have health insurance? What health insurance do you have? Type thing. Same thing as, hey, are you covered? Can we move forward with MRI that could be a couple $1,000s? And if that's not the case, usually if we send an MRI to a place like Reyes, which usually does all of our MRIs because they actually work on a lien as well, they will actually call the attorney and get approval, almost like a prior auth before doing anything too expensive. And so usually instead of calling health insurance or getting prior auth through health insurance, we have our MA call the attorney and just say, hey, this is what we want to do. This is the cost. Are we good? And they'll say yes.
Interesting. So very similar.
Very similar.
Just different.
And a lot faster. We can just do a quick phone call and say, hey, we good? And they'll just say, yeah, we're good.
Yeah, that makes sense. How are those relationships then? I imagine that's important. Kind of who do you have to communicate with and how do you keep up those relationships?
Yeah, so I mean, luckily I've been in the industry for long enough that I know them. Most of them have my cell phone number. So a lot of times I'll just get a text like, hey, can you chat for a second? And I'll just call them and they'll say, hey, this is the patient, this is what's going on. You're good to go. And so usually they can call our office as well and the MAs will just put in a note like, hey, attorney gave approval for ongoing treatment basically. And so kind of gave us the green light to go with what we need to do. And so I feel like the relationships are pretty good. Every once in a while we do like the other night, one of the attorney's offices took us all to Top Golf and we went and played and chatted with the attorneys, got to know them a little bit better. And we do it's a lot of golf. We did a golf tournament in September. They do movie nights every once in a while. They'll rent out a movie theater and have providers come. You meet all the attorneys, but really it's just they get your personal number and they call you, which is his own evil sometimes.
Good networking.
I was going to say, you open that door.
You open that door, but hey, it's good to have it there because then they trust you and they send you more patients,
Yeah.
And so.
Interesting. How about the relationships through the community then? Because you were alluding to that not every clinic will work with this patient population in that circumstance. But I assume that every so often you're going to need some services or collaboration outside of your network. Yeah. How do you approach that?
Yeah, so honestly, our bosses have been pretty good about it. I feel like we were limited at the beginning, like when you were with them years ago. We were really limited on what we could do. If we wanted an EMG, it would take 6 months to order an EMG to find someone who'd be willing to do it. But our bosses have actually been really good about going out to the community and finding places and just basically convincing them to do it. To see patients on lean. Now, we almost have everything we need. Like we use Dr. Edwards for spine surgery that you guys work with. We have basically a surgeon for every specialty that's willing to work with it. And so we really didn't have a good community collaboration to begin with, but that's something that our company's been working on, just trying to really explain to providers, hey, this is what's going on. These patients aren't served, and most providers are willing to do it. Once they actually understand this is what's happening, this is what's going on. There's a need, and it's not like it has to take over your complete practice where it's like, oh, I'm waiting 5 years to get paid. But if, say, you have your full-time practice, if you see a couple patients on the side, it's just extra patients that, you get paid later on, and you might not need that income right away. And so we have an EMG specialist, Reyes. We work with Reyes all the time now because they work on leans. We have surgeons. We have pain management. We even have therapy. We have mental health counseling for PTSD after car crashes, or like, for example, I had a patient the other day who got bit by a Great Dane and kind of threw around, and she's now terrified of dogs. Anytime she walks, she's terrified. She has a lot of PTSD with it.
That happened to me as a kid.
Oh, really?
And I remember that stuck with me for several years.
Yeah.
I can imagine.
And you kind of, I feel like mental health gets downplayed a lot, and I feel like our age is now getting better at recognizing that. And so you'd be surprised how bad these 80 mile an hour accidents, they give you some PTSD. You start driving again. Me as a provider seeing these patients, when I stop at a red light now, I'm watching the rearview mirror please don't hit me. 100%. Please don't rear end me.
Have you been in a car accident before?
Not a bad one. No.
It was a couple years ago, just a side swipe on the freeway.
Yeah.
But you're going 80 miles an hour.
Yeah.
And it's a pretty intense situation. Luckily, there was not any real injury or damage in my scenario, but it does make you stop and think for a little while. It can mess with you.
Yeah, and luckily I've never been into a car crash, so I've been seeing car crash patients for almost 6 years now. So I feel like I'm testing fate there, but there's a lot of PTSD with that, and a lot of headaches because of that. And so that's one of the areas we get into. I'll kind of expound on what we do. We have a neurologist as well that. I don't know if you were there when Dr. Kutcher. He's actually one of the neurologists that works with the NFL, the NBA, and all of them. And so he actually has a PA who works in our clinic almost full time now. And so seeing patients with concussions after car crashes, and you'd be surprised how much that PTSD plays into a factor of you not getting better. Most of those neurology appointments are like, we need to get you with some counseling, and really we need to focus on the PTSD rather than the migraines or anything else, because this is what's causing it. And so
interesting.
We have a full counseling practice now, so we kind of have almost every modality that you could need. We even have a general surgeon who fixes hernias from like the seatbelt. So we kind of, and we have a dentist. I mean, we got a whole network. We got our own network of providers that see car crash now. Cool. And it's crazy. I didn't know any of this. Utah didn't have any of it. California, if you go out there, they have every orthopedic office, every doctor's office has a PI side. I didn't know that.
I didn't either.
Yeah, they all are established PI. Because there's so many car crashes and injuries out there that there's such a need.
Somebody saw the need and they're like, let's build this.
Just like if you drive through Vegas, every single billboard is
a personal injury attorney. That's true.
Other states knew it. Utah's now just catching on. So finally we actually have at least our network. I know we're the first ones to kind of get this big of a network, but
that's good for
you. I know other places
are
starting to build up. But our goal is to collaborate with everyone. We want to serve these people and give them all the chances they can get to get better. I
love that.
That's fantastic. How about somebody coming into this as a new graduate?
Yeah.
Do you feel like it's any different of a learning curve, any different of a scenario? Is it an ideal new grad position to get into what you're doing?
Yeah, I mean, so I'm the lead PA at our practice, and I've trained about 6 or 7 PAs now, fresh out of school. And so I've talked to them a lot about it. I've also brought on 2 or 3 other pain management providers who switched over, and so kind of got a good feel of that. And I feel like it's a good mix of getting your hands on with orthopedics and not having to take call. Yeah. So I'll kind of, my schedule is very, very cushioned. You guys are gonna. I work Monday through Thursday. I work Monday through Thursday, 8 to 4. Friday half days, no call.
Yeah.
No rounding in the hospitals, and I got to do orthopedic surgery.
Are you in the OR still?
Yeah,
do you still go in?
Still in the OR.
Who do you work with in the OR?
So Dr. Hatch is one of the main guys I go with. He's from Park City. He's with the Metcalf Cooley group up there.
Yeah.
So he's our shoulder elbow guy. We have multiple guys for everything now.
Sure.
And so I actually scrub with Dr. Edwards, Gary.
Oh, right. Yeah.
If he comes with us, I go scrub with him there. We do knees, hips, shoulders, whatever he does, everything.
I didn't even know that.
Yeah. So I actually was scrubbing with Dr. Edwards before you started here.
Yeah, with Gary.
Yeah. So I've been scrubbing with Gary for 3 so years now.
That's awesome.
Not very often. I mean, like couple cases every couple months, But Yeah, I got to go in with him. So I know I see you're wearing Jordans. I know he loves.
These are from him. Shout out Dr. Gary Edwards.
Yeah,
right
I
here.
was gonna say, I figured as soon as I saw him, because every time I see him, he's got new Jordans.
He does.
Wearing his Jordans in the OR. I'm like, dude, you're gonna get those ruined. But yeah, so I scrubbed with Dr. Edwards as well. We actually have a new surgical director. His name is Dr. Cooper. I don't scrub with him because his wife is his PA. And
Oh,
that's cool.
I went and scrubbed with him a couple times, but then
Is
his
it
wife-
though? I don't know.
I told him, I
That's
was
another
like,
topic.
I don't think me and my wife could handle it. I think I would be dead by the end of
Yeah,
it. You know?
yeah.
But yeah, and then I've scrubbed in spine surgeries with Dr. Felix, Brent Felix up at St. Mark's.
Yeah.
I think the only one I have not scrubbed with is John Edwards, because he just comes here. He doesn't go to our facility.
Yeah.
Basically, anyone that goes to our facility, I scrub with them. So I go with spine, limb orthopedics. I've done podiatry. I've done all of the above. Basically,
That's cool.
I just go
Jack
in
of all
and
trades. He
listen
does it
to what
all.
they tell me to do.
Yeah.
So,
Have you ever assisted on a coccygectomy?
no.
Okay.
No,
I sent a few of my patients up to Dr. Felix for a consult regarding that, but I know that's a space that's
he doesn't like to do those.
No, I can't imagine anyone does.
No, I've sent a couple, and I sometimes I get surprised. But the nice part is that now, at one point I was scrubbing with 9 different surgeons in all different specialties.
That's crazy.
Oh, there's what's his name? Dr. Olson
Uh-huh.
He's at Metcalf Cooley. He's a hand specialist, and then Dr. Williams as well as a hand specialist.
Yeah.
So
Well, that just seems overwhelming though, to try to learn all of the ins and outs.
honestly, the biggest thing is just stay humble. Don't act like you know anything. Go in there. I don't care if you have 20 years of experience. You go in and act like you know absolutely nothing about the surgery, and just let them
direct you. Yeah.
And so finally, me and Dr. Hatch have been scrubbing together for probably about 4 years now. And so I'd say in the last year, I've started to kind of like feel confident enough to be like, hey, you know what? No, I know the patient better. I've been seeing him for months and kind of have better input on that. But when I come in, a lot of times I'll come in, I've never seen the patient. I'm just scrubbing. And it's a surgeon's patient. They've been seeing him for a while. So you feel a lot more,
Tell me what to do.
Tell me what to do. What do you want me to hold? What do you want me to suture? What do you want me to cut?
That's probably an important trait, though, is being adaptable like that, being able to work with a lot of different people and understand your role and how you can be supportive. Because, I mean, that says a lot. Ultimately, patient outcome is the goal there. So
right,
that.
And the surgeons are great we work with, so it's nice I can trust them, and I know them well enough to be like, they're making the right choice here. So you kind of rely on them for a while, but I feel like that's a key for new grads coming out of school is, hey, trust your providers, stay humble, just act like you know nothing. Yeah. You know, they'll teach you, because every provider does it different. Every surgeon is going to have a different outcome on it. So or outlook on it. So if you come out and say, hey, you know what, this is what it is, they might say, hey, you know, I have better success doing this in our practice, you know. And so just staying humble with it, willing to learn different ways. And then when you go out of that situation, now I've scrubbed with 9 different surgeons. When I see a patient, I can be like, okay, so this is what, in my head, I'm thinking, this is what this surgeon would do. This is what this surgeon would do. Which one would the patient is going to benefit the patient more? Which one would the patient prefer to do? Because it's that patient-centered care. So a lot of times when I'm seeing patients now having that experience, I'm saying, okay, these are your options.
Triaging it that way.
Yeah, these are your options. Like, here's 3 or 4 options. This is what 3 different surgeons would say. Which one do you feel most comfortable with starting? And we start with that, and
that's cool.
Kind of work it that way. And so that's the nice part of having all that experience. But going back to your question on new grads, I think it's great for new grads. It is a unique area of medicine, so you will get into it, and it's nothing like anywhere else you'll ever work. So if you're like, you know what, my ultimate goal is not doing something like this, I feel like it's a little bit harder to say, yeah, let's jump into it. But it does give great experience. It is hard to get into the orthopedic world, and so right out of school. Mm-hmm. And I was lucky enough to get that job right out of school. And so, but like for you, Alex, you took a year with First Care getting basically orthopedic experience and switching to spine orthopedics and neurology. Like, I think that's a great stepping stone, is getting a job where you get a hands-on experience with patients with spine pain.
Oh yeah.
Every single one of my patients has neck and back pain.
Oh yeah.
There's always shoulder, knee thrown in there, but every single one of my patients has neck and back pain.
They do. Yeah. And back pain, about the most common complaint in all of medicine. Right. And you're going to get to see a bunch of it in that.
Yeah. So we get a lot of patients that come in like that. And so I think new grads, it's great experience, you know.
Oh yeah.
Great to be thrown into actual, if you want to be seeing someone for acute injuries, PI is an awesome place to be. If you want to manage more chronic health, it's probably not your cup of tea.
Yeah, and that was me. I was new grad, first job out of school, and talk about thrown right into it. I could not explain it better. It was almost immediately of, you're going to hit the ground and you're either going to sink or swim.
Yeah.
But it was such a good way to just hit the ground and get going immediately, because you'll get a ton of opportunity.
Oh yeah. I mean, we're run just by mid-level providers. We have one nurse practitioner, 4 PAs, and we actually just hired on an ER doc last year, so he's our medical supervisor, so we get access to him. He was an ER doc for 17 years and then joined our practice. So he's got a lot of the acute injury experience, but every day I am by myself almost every day, just me and my MA and a receptionist, and so I have access to call other providers if I need help, or surgeons, but most of the time that's the nice part. I get autonomy.
Yeah.
I get my own autonomy.
On the clinic side, one of the most daunting things when I got into the personal injury space was the documentation of things.
Yeah.
I read an IME report I remember early on, and it was so descriptive and like well versed and just concise, and I was like, I am never going to be able to replicate this. Like, super daunting. Has that been the kind of a growing learning curve for you? Yeah,
it has. I'm known for my notes being short and to the point. I don't like the fluff because there's so much. If I added all the fluff, my note would be 15. I would never finish.
Never. I
would never get through my 20 patients and type all my notes. And so I like to be pretty concise with it on, this is the accident, this is what happened. If you read it, it's like, man, does this guy know grammar at all? But if you read it, you know exactly what's happening.
Yeah.
And so I've never had complaints about it.
Yeah.
And so I kind of found my own little, how do I make this easier? Just get straight to the point. I found out what the attorneys are actually looking for in the note, what the car insurance is actually looking for, just like health insurance. You know what they're, the hot word you have to write in the note
for sure
to get it covered.
Yep.
And so you learn the hot phrases, you set them as templates, and you just
slide them in there.
Exactly. And so
that's pretty slick. Yeah.
And so I have a lot. It took a while though. It was pretty daunting at first, but luckily, like the new providers we have coming on, I email them all my templates, and so they get right in and they can save all my templates. They just inherit
pick
them.
Up where you
and we try to make it pretty generic across all providers, so that when car insurances and attorneys are getting the notes, they can find exactly what they're looking for when they need it. And so I feel like it took a while. It took 2 years for me to like feel confident with the note that I was sending in. But IMEs are a whole different beast.
That's true. That's true. That is true.
So those ones take a lot more time. But luckily, AI now is coming out, so all the providers are using that. We have a AI dictation service that we just signed up for. We just hit record, go into the room, walk out, hit stop, and it dictates a complete note for us.
And you've been happy with it?
We just started like a couple weeks ago. We're still tweaking it. So
we're in the same phase.
The problem is I can type my note faster than AI can spit it out. And so with my templates, you get so versed at it that it's like I can walk out of the visit almost done with my note.
Oh, wow.
Because I'll pre-chart going in before. My MA will go get a lot of the details, come out, tell me I'll pre-chart everything, put some exam stuff, and then go see
fire
the
off the assessment plan. Yeah.
Efficient. That helps.
Yeah. So, and with PI, a lot of our things are the same. So it's, okay, this is fine. Let's send for MRIs. So I got a quick, easy template for that. But
that's
I think the AI will help a lot with IMEs.
Yeah.
You just sit there, you can just read through reports. Even what I've seen is
just consolidate.
The cool stuff I've seen is I've plugged in x-rays into AI and it reads the x-ray for me. It'll tell you, hey, there's a fracture here. This is what it looks like.
That's
you
wild.
can literally I screenshotted an MRI of a rotator cuff tear. I knew it was a rotator cuff tear and plugged it in.
Picked it up.
Told me rotator cuff tear with this much retraction. Like,
that's slick.
So it's scary for radiologists in the future,
but that's the way it's going.
But I mean, I feel like that's the hardest part in orthopedics is reading images.
Yeah.
Some of these images you're like, I have no
that was
idea.
the hardest part, I would say, getting into what we do, because we see a lot of imaging studies.
And they don't teach you that in PA school.
No,
they
don't in nurse practitioner school either. So.
Right, you just keep looking at it. You're like, okay, this is what a rotator cuff tear looks like. This is what it looks like normal.
This is normal anatomy. This is atypical.
And then you get a weird one. You're like, I have no idea what's going on. This person's anatomy is so off.
Yep.
I had a hip dysplasia patient the other day. I was like, where's the femoral head? Like, it's gone.
Oh,
like,
man.
I can't read this. I don't know what I'm looking at. So I plugged that one into AI, and it was no
interesting.
Problem. Took like 30 seconds. Gave me a report on it. So I still went to the radiologist. I'm not quite relying on it yet.
We're not selling everybody on AI just yet.
No. But it's cool what's upcoming with it. So
the other part of the personal injury world is the compensation.
Oh yeah,
which is quite unique.
Yes,
because correct me if I'm wrong, but standard billing is 3 times what Medicaid or Medicare would pay.
Yep. So most visits we get paid triple what you'd get paid in health insurance.
Yeah. So how does that translate into the healthcare provider?
Yeah.
As far as compensation and pay and salary, or are you revenue based, or what's a typical model there, and is it competitive pay for what you're doing?
Yeah. So it's very competitive. I would say I'm paid within the top 95% of all PAs,
That's really good.
cardiothoracic surgery, whatever, as the lead PA. And the reason I get paid so well is I have a business mindset. And I feel like that's, a lot of PAs have that mindset. Is you go into medicine, it's like, hey, you know what? Yeah, you're very valuable as a PA, but you could be so much more valuable if you dive into how do I make this business grow?
Yeah.
Because that's when you're going to make yourself invaluable. And that's what I tell all of our new providers coming out. I'll tell you, we offer about 120 coming out of school. Like fresh out of school, we'll offer you about 120 with 15 PTO days, health insurance coverage, and pretty good schedule. You're only working 38, 40 hours a week. Like you're not doing call, you're not doing the OR or anything like that. So, and it's chill days. Like I average 15 to 20 patients a day.
Yeah.
Our new providers are averaging like 8 to 10 a day. And so, it's pretty chill and you get paid really well and you get good learning opportunities. So they get paid well, but there's a chance to bump up. I'm kind of like, as you know, I think you were the first or second PA for First Care Medical. And
I was employee number one.
You were employee, yeah.
Literally.
He started, Alex started this whole thing that I'm working with. But,
here's the byproduct.
Yeah, so Alex and then Colin was right on board with you.
He came right behind me.
And they're both gone. I'm basically, I call myself the OG.
Yeah,
we go around,
I'm
the OG because even before First Care Medical, me and Dr. Sonnenberg were already doing it.
That's true.
We were already seeing it all.
Yeah.
So I feel like I'm kind of blazing a path here for more PAs to come out. And so I actually teach it. I should add this in my intro. I actually teach at UVU PA school as well. I go do some X-ray classes and orthopedic classes there. And so I always tell them, hey, you know what? Like, make yourself invaluable. Like, that's all you can do. I got into this profession. I had no idea that this area of medicine even existed. Like, I don't think anybody did. And so I always tell them, you'll never find your perfect job on Indeed. You're never going to apply for a job and that's your dream job.
Yep.
That's never going to happen. You have to make it your dream job. You get an area of medicine you like, turn it into your dream job. Get a good supervising provider, and then go to work. Figure out, hey, how do I get this practice busier? Because if you make yourself more invaluable, you go to your annual review, you can say, hey, you know what? Could I take half Fridays? And then you can prove your value. Look, I'm seeing this many patients and this, I'm easily making what I'm worth plus more. And they're much more willing to give that. But yeah, back to your billing, we charge triple because we're holding it for 5 years. It's basically like a loan with interest on it. And so that helps us get paid better. So if you can prove your value over years and just say, hey, look, you know what? I bill more than most PAs in the nation.
Mm-hmm.
Like I feel like I was over like 5 million last year of how much I billed just in clinic, not including OR time, not including anything else.
Wow.
And so it's a lot easier to go forward and say, hey, you know what? Give me a small percentage. So my next goal is to go and get a production pay. I've been working that one out for a little bit, but
makes sense.
I'm still working on that one.
Yeah, I like the mindset though of always looking to show your worth and improve the business as a whole. Because they're investing in you when they hire you. They're investing in you. You're a provider now. Like if you're a new grad, you got to get in that mindset. I'm a provider now. Basically, I'm helping run this business. Mm-hmm. I'm not just going to show up, clock in, and clock out, get my time. I want. Yeah, that's a good. I'm in business development.
I love that.
I'm frontline seeing these patients. If I do a bad job, it directly affects everything. Yeah. And so if you get a provider, your supervising provider or a business that also values like, hey, this person's
making us better.
That's a great fit. Yeah. Get that job, hold on to it, don't let go. Yeah. Make it your dream job.
Grow with it.
Yeah. Grow with it, exactly.
Yeah.
Well, there's so many cliches around that, but the sentiment is there for sure.
Yeah.
Well, good. I think we got to get back to that cliffhanger.
I think we do.
Oh, yeah.
So, Brock, tell us a little bit more about this story.
Yeah. So I'm pulling this one from the memory bank from when I was in school. I was in a gynecology surgery rotation, and one of my first days on the job or on the rotation, provider was awesome. Just sent me straight in. I had no idea what was going on in women's health. So I was like, okay. He's like, just go get the history. He's like, you've done a couple of rotations. Just go get the history. He's like, we'll do the exam together later. I was like, okay. Went in and started talking to her, and I was just like, hey, what's going on? And she's like, it's better if I just show you. It's never. If a patient tells you that, you got to prep yourself. Solid. Yeah. Make your
poker face.
Put gloves on.
Yeah. Get your PPE.
Get your PPE prepped. You know something's coming. So she pulled off the drape, and there's a foot of uterus there, just hanging out, sitting on the table.
What's that doing there?
Yeah, her 6-year-old son's sitting right there. She's like 90. And I told her, I was like, oh, how long has this been happening? She's like, yeah, years. I have 12 kids. So it just falls out. I'm like, okay. I was like, so basically, what do you do? Trying to get like a history of it, you know? The guy sent me in for history. I got to have some answers. Like, okay, so what do you do? And then the son chimes in, yeah, I just push it right back up there for her.
No, you don't. Yes. No, you don't.
And I'm telling you, it was at least a foot out. So you just know that's
just
a full,
just get it in. Get it in.
Exactly. So she was coming to us for a hysterectomy to try to remove it, but she was too old. So it took me back, and
oh man,
that's definitely one of those stories you tell when you go out with friends. Like, oh, what's your craziest story? Here's one. If we're not eating food, here's one you can have. But,
Mom, you're good till next week.
Right. You're good.
That's terrible.
Oh man. Yeah. And I got a PI one I'll share with you too.
Sure.
So we you guys know as providers, we like to joke around a little bit when we're back in the provider room.
Oh, yes.
So we got the lucky ability to see our patients before they come into the clinic. One of ours has like this full window in the provider room, so we can see the cars turning into the clinic. And we know we're like, our clinic's like the only one in the building that actually has people coming in and out. Yeah, we know. So we actually like, side story, we track how many people turn in the wrong side. There's like a double entry, and they always turn in the do not enter side. So we're like, that's our patient for sure. No, just teasing. But we had this patient, it was like middle of January, snow all over the road. See this guy riding down the middle of the street with no hands on his bike, just pedaling away, holding 2 bags in his hands, just cruising along. Of course, he turns into our clinic, and so the other provider's like joking, he's like, hey, that's your next patient. I was like, no way. Like, that guy's just passing through. The front runner station's right there. Like, he just passed through. No, it was my patient. Comes up. Guess what happened? He hit a car on his bike. You want to know why? He has complete rotator cuff tears on both sides. Can't lift his arms.
Can't hold the handlebars. And that's how he gets around. He rides his bike everywhere, hours a day, just with his legs.
Man.
7 bike accidents in the last year. And he keeps coming back to me. I'm like, dude, I can't help you. Like, you got to stop riding your bike.
Yes.
So.
Oh my.
That one's a little more mellow instead of
That's awesome.
I love
the cringy ones. But yeah.
I still can't imagine that conversation. Son, come here for a minute.
Can you come push this back in? Oh, man.
That's a dedicated son.
Dedicated son.
Yep. All right. Well, this has been fun, Brock. We appreciate it.
Well, I appreciate you guys having me on.
Super exciting to have you here. Tyler, what'd you learn today? What do you think?
Man, I can't stop smiling. My cheeks hurt. So, but no, I love it. I think, first and foremost, I think it's an introduction to the personal injury space that a lot of listeners probably wouldn't know otherwise. So, shout out to that. I think you've pioneered, both of you, really. I mean, gosh,
Alex
you've both been in it. Yeah, OGs in the building. But I think it's a great need, and I've seen it firsthand in my practice, you know, when we see patients. So I see the need, and I love what you guys are doing, that multimodal approach, having all of these auxiliaries ready at your disposal, and I think the community is greatly going to benefit from it. And so it sounds like the work-life balance and the pay structure is competitive. So there's definitely interest that I think we're going to get from listeners. So with that, how would they reach out to you?
Yeah, I mean, they can email me. I'll put my email on there. Or
he's going to give out his personal info.
No, my work email. Because I'm the worst. If I gave out my actual number, texts, no, it's
you're not going to respond.
I mean, I don't even know if I said this. I have a wife and 6 kids. Oh. So my oldest is 7.
Wow.
You have 6 and your oldest is 7.
7.
Wow. You have twins or something?
I have 4 boys that are all individual, like a year apart, and then we ended with 2 girl twins. And so
ambitious.
My hat goes off to you, my friend.
No kidding.
So we're busy, so I never respond to texts or anything like that.
Fair enough.
I mean, I'm on LinkedIn. They can message me on there, but I never... I'll check it if I get an email saying someone messaged me. Right, so if you have questions, I've actually had a lot of people reach out to me on LinkedIn and say, hey, I've seen your work at First Care. I'm just about to graduate. I'm interested in this.
Wow.
Like, what would you say?
Cool. Yeah, that's perfect. That's exactly what we want to shout out.
So LinkedIn, I've had a couple. I've responded to them on there. So that's a great one. I can put my email on there, but that's the one I actually check every day. So that one's probably better to get to me. But
perfect. Love it. Well, with our clinic, we're on the social medias.
Yeah, we are.
Yeah, I have social media. I'm never on it.
Yeah. So. We don't have personal social medias.
No, the clinic does. Yeah, our clinic doesn't have anything like that. Yeah. So,
but our Instagram is Summit Brain, Spine, and Orthopedics. YouTube is Summit Medical Institute. And then we always love seeing people in person. Someone's going to take me up on it one day.
It's better.
Eventually.
Yeah.
But we're at the Mountain Point Hospital in Lehigh every Tuesday morning at 7 a.m. for interdisciplinary case discussions. We like to get the input of the whole community. So come chat with us, come hang out with us, and come collaborate with us. From the listeners on the show, we want to hear feedback. So give us a review, give us a rating.
Come be a guest.
Come be a guest. Tell us what specialty or who you'd like to have on here to hear from. We want to hear it all. So we'll be looking forward to interacting with you that way. Always a shout out to our production team, Amelia and Dallin, doing the work behind the scenes for us. Big help. And we always love having Tyler with us.
You know, I'm glad you said that, man.
Anything else you want to add?
I think that's it.
This has been great. We'll close it out. Brock, thanks for being here. This is episode, we should count. We're probably...
Shoot. 17. 17.
We're up to 17 now, so we're doing well. So stick with us. This has been episode number 17 on the Many Minds podcasts, where we are encouraging collaborative community healthcare using Many Minds for better outcomes. I'm Alex Davis.
And I'm Tyler Murray.
We'll see you next time.
That's a wrap.
Are you ready for this? Are you ready for this? Are you ready for this? Are you ready?